The U.S. Department of Agriculture has issued a national mandate requiring raw and unpasteurized milk to be tested for bird flu. This comes amid an outbreak of avian influenza that has affected more than 700 cattle herds throughout the country. The virus has been spreading among humans as well, with nearly 60 cases detected in the U.S. this year, according to the Centers for Disease Control and Prevention. Dr. William Schaffner joins us now. He's a professor of preventive medicine at the Vanderbilt University School of Medicine. Doctor, always good to see you. Can you help me understand this new milk testing initiative and at what point this is being done? Because most of the milk we get in our stores is pasteurized. Is that a process done after it leaves these dairy farms?
Well, Lindsay, the issue is let's put in another layer of security to make sure that as far as we can, contaminated milk doesn't even enter the pasteurization process. Mind you, the pasteurization process makes milk pure. It takes away the viruses and the bacteria that are in the milk. It was a process that was initiated at the beginning of the 20th century. And for the first time then, it's now 100 years later, that milk was made safe enough to give to children. And we want to preserve that. We know that this virus in a dairy cow concentrates in the milk. And so by testing the milk before it even gets to pasteurization, we'll provide another level of assurance that the dairy products that we consume, milk, cheese, sour cream, yogurt, all those delicious things are absolutely safe to consume.
Doctor, what about people who consume raw or unpasteurized versions of those tasty treats you just mentioned? Are those safe right now?
Well, for a long time, we've said that raw milk is unsafe. There's a long history of a variety of infectious diseases that are transmitted via raw milk. And so putting this in before raw milk can go to commerce, be sold as it can in some states, puts another layer of protection for people. Mind you, there are circumstances, such as in my own state, where a group of people can actually purchase a cow and then use the milk from that cow privately. I think that that will not be included under the law, but there's a lot of raw milk and raw milk products that are sold commercially that will now have this extra level of safety to protect the consumer.
Doctor, 60 cases so far in the U.S. this year. Is this a public concern yet? And should people be on the lookout for symptoms? If so, which ones?
Well, we in public health and infectious diseases are on the alert for this. We are testing people who have influenza and influenza-like illnesses, and we're doing this much more intensely now than we even did a year ago. So our ability to detect these illnesses when they occur and immediately offer treatment, and our antivirals do work in treatment, is even more enhanced. I think the average person doesn't need to be concerned about this.
Dr. William Schaffner, we appreciate you. Thank you.